My next guest is Dr. Michael Aziz, who's a renowned internist, anti-aging, regenerative physician specialist, practicing at Lenox Hill Hospital in New York City. Dr. Aziz regularly provides medical commentary on many health networks. He is also the author of a book called The Ageless Revolution. Dr. Aziz, welcome to the show.
Thank you so much for having me, Barry.
So as I age, I keep thinking that so much of aging is just genetics. It's kind of like the hand you're dealt. Is that true, or can you do a lot about it?
No, actually, that's a myth, and 80% of how we age depends upon the things we do in life, from diet to sleep to exercise. Only genetics only play 20% role in how we get and how we age.
So if you want to live longer, and again, I don't think just living longer and not being able to have your mental facilities or be able to move is really any great prize, but if you want to live a longer, healthier life, what do you tell your patients of the first one or two things that they really have to do as early as possible?
The problem is I really have to change the mindset not only of my patients, but also of the people who are going to read my book, because I'm treating aging as a disease. Many of my patients are stuck in the old model of going to the doctor once a year, doing routine blood tests, checking their cholesterol, their CBC, but that's not going to affect aging in many ways. For us to age better, we need a very, very proactive approach about knowing all the advances in medicine that happened in the last 20 years that can make us not only have a better health span, but a longer lifespan.
So, for example, Dr. Aziz, what practices on a daily basis should we be doing?
I think when it comes to longevity, the most important, of course, is diet, and diets play a huge role in longevity. We see that in the blue zones and the countries in the world where they live to 88 and 90, like Monaco, they live to 90, Hong Kong, they live to 88, and they eat mostly a plant-based diet. We are really following the wrong diets here in this country between low-fat, they're very high in sugar, low-carb diets and keto, which are now in trend, are very high in animal protein and processed meat and artificial sweeteners. We know that nitrites in bacon, sausage damage the DNA. They lead to cancer. And unfortunately, that's a trend going right now in many of the magazines. You see how many people are successful on low-carb and all those popular diets. But really, we are on the wrong track when it comes to longevity.
So how did we get here really as Americans? Is it because the advertising is so good from these companies to get us to eat, or because for a lot of America, where things are a lot more plentiful, food's a lot more plentiful than other parts of the world?
I think the problem is we're eating too much processed food, and I think we've been brainwashed by the lobbyists that the processed food is better for us. So many people don't eat eggs. They think cereals are better. We don't eat butter. We think vegetable oils are good for us. So all that stuff, all the seed oils, cottonseed, corn, causes inflammation. And those lobbyists also influence the guidelines from the government, like the original USDA food pyramid. Low-fat diets were really invented by politicians back in the 70s. They had no scientific basis. Sugar is the worst thing you could do to age. And as a result, we were lost as a society, and we just followed whatever people tell us. Could be anybody with no education writes a book, and then before you know it, we're following this trend. And that's why we really have to get back to basic. It's eating natural food, eating natural fats, butter, olive oil, avocados, and eating more vegetables and less animal product and no chemicals.
Well, Americans have always been into trends and fads. How do you think these guidelines might change under, perhaps new, Health Secretary Robert Kennedy Jr.?
I am not sure about his position. I know his position on TRT, which is good because he takes
What's
that.
TRT?
I think he has a...
Dr. Aziz, what's TRT? What's TRT? We don't know that.
Yeah, and he looks good on TV. When he takes his shirt off, he looks like he's fit. He's concerned about the health of... Yeah, so he's concerned about the health in the country. He has some views that, the fast food should change to animal fat for cooking instead of the seed oils. So, I think they're very, very valid points, and I hope he surrounds himself with good people who can help him, guide him, because I don't think he's a physician. So
why do I think the average age that I think men live to in the U.S. is like early 70s, and women live to like mid 70s. Why do women live longer than men?
It has to do with the fact that testosterone and sex hormones, so estrogen, progesterone in women, lead to a longer longevity. And testosterone, if you do too much, that could be also harmful. So that's why men die more than women.
What about stress?
Earlier.
That is a really big factor for a lot of small business owners. How does stress affect the aging process?
Oh, stress, I talk about it a lot in the book, The Ageless Revolution, because stress plays a huge role in longevity. One is it affects a hormone called insulin. And before you know it, if you have too much stress, you can end up with diabetes. You can have high sugar level. You end up gaining weight. Many people who are just, they can eat the same number of calories, and then one is stressed, one is not. The person who's stressed can gain weight. It leads to, insomnia, lack of sleep, and lack of sleep. You are making a hormone called melatonin. Melatonin is just not a sleep hormone. It is the most important antioxidant in the body that protects the mitochondria, or the battery of our cells. So stress affects longevity. And then finally, also, too much stress shortens the telomeres. Those are the end cap of the chromosomes. And when people have shorter telomeres, they have shorter life. So if you're stressed, that's not good. That's going to mean probably a shorter life.
So what kinds of people usually come to see you? Is it people that already have a problem and they're trying to overcome an acute problem, or folks in general that just say, listen, I'm 65 years old. I want the next 20 years to be my best years?
I'm a traditional doctor, but I'm trained to be a functional doctor, so I treat aging as a disease. And as I see a new patient, I see what issues they have. I deal with that. But I also educate them about what they need to do to fight aging on the cellular level, because that's a very brand new approach that no one is doing. You go to the doctor, they usually deal with your blood pressure or your high sugar or high cholesterol, but they don't deal with the issues, all the vitamin deficiencies we have to fix, all the hormonal changes that have to be fixed, fighting aging, the hallmarks of aging that I talk about in the book, because really the reasons we age is the cell starts to malfunction. So basically, I'm dealing with why the cells deteriorate, why do they malfunction, why they stop working and eventually die. So we want to extend the life cycle of the cells, and we do that by targeting the hallmarks of aging.
So Dr. Aziz, I've written a lot about how hard it is for people to change their habits, right? And they really only do it, in my opinion, when they're in a lot of pain. How have you seen patients effectuate change in their lives, whether it's diet or stress or just to live differently?
I think people have to be motivated. It has to be something in you that tells you, I need to be healthy. For me, it comes from the fact that all of a sudden I found myself older. I did not like how I look, and I had to change. I had to lose weight. I had to get to control my sugar intake. I had to drop my cholesterol. I had to drop my my high sugar, that I was pre-diabetic. And it was something in me that led me to develop this plan and share my information and my story in this book, The Ageless Revolution. But it really is up to the person. I've also just talked to a recent billionaire here in New York, and he's very much overweight. I will not mention his name. And he was not interested. So, you really cannot, it has to be up to the person to be interested in changing their life.
It's interesting to me because about 30 years ago, I got diabetes when I was 35. And the way I found out was that I had blurry vision, and that really kind of scared the crap out of me. And so I really believe that when you have a scary incident, it really does propel you to more change rather than just, I can deal with what's going on.
Yes, absolutely.
You talk about in the book how your chronological age doesn't matter, right? But it's really the biological age that we should focus on. Tell us the difference between those two.
So chronological age is the date that we were born or our birthday, and that you can lie about. You could say, you could be 50, say, I'm like 35.
Or guess how old I am.
Concept.
Right.
I don't know. Everything is on Google now. Everything you can Google it.
Yeah.
You can, biological age is a new concept in medicine. It tells the age of our cells, and that you cannot lie about, because there are tests that tell you how old are your cells, and that's based on your lifestyle, the things you do. So somebody could be 20, but they're doing all the wrong things. They're doing drugs, they're smoking, and their biological age, they could be 40. Or someone who is 50 or 60, and they're doing all the right things, and their biological age is at a much younger age.
Can you turn back the biological clock?
Sure. Yes, was all that's what this ageless revolution is all about. It's turning back the clock. It's slowing the aging process and turning back the clock with a variety of weapons. So I talk about lifestyle in the first part of the book, but then I go on talk about diet. I copy the diets of all those blue zones and where people live to be 90 to see what they do. And then I move on to supplements and medications and peptides, hormone replacement, all the weapons that fight the biological age.
All right, so of course the biggest question is, how does alcohol affect your biological age?
So alcohol is a little bit of a hormetic stress. It affects the cells in certain ways. In small amounts, in moderation, it's okay. We see many countries, many people live to be 100 and beyond are not drinking a little bit. But I think alcohol in excess is very bad. So alcohol, if you exceed the 6, 7 drinks a week, it increases mortality by causing liver damage, liver cirrhosis, high blood pressure, increases the risk for esophageal cancer, and so on.
Now, cannabis is recreational legal in a lot of states. Has there been any research, or have you done any research on how cannabis affects the aging process?
There are some, but it damages brain cells. It's not good, and we have an epidemic of Alzheimer's disease in this country. And
Of what kind of disease again?
Worse.
What kind of disease?
Alzheimer's disease.
Alzheimer's disease, yeah.
Yeah, so, and then when you use cannabis and all that stuff, then you have to smoke, and that's not good. It's just not good. So it does damage the DNA as well.
Why do you think we're seeing so much more Alzheimer's? Is it just because it's getting diagnosed more, or there's really something going on here?
There's more diagnosis, but definitely the fact is that the path to all the big diseases, that the age-related diseases, diabetes, heart attack, stroke, and dementia, is all related to sugar, high sugar intake.
And so if you reduce your intake, you'll have less of a chance of getting those diseases long term?
Correct. You have, 1/3 of the country are pre-diabetic.
Yeah.
70% of Americans are overweight, and that is causing and fueling the epidemic of age-related diseases that we see even in young people, from high cholesterol, high levels of heart attacks, low immune system, everything.
So what's your outlook on, I guess, a healthy America? Do you see things changing and evolving, or it's kind of status quo?
I think it's going to take a lot of education. It's going to take a whole generation of doctors like myself to deal with aging as a disease, know the hallmarks of aging. I'm probably the first doctor and who authored the book to target aging as a disease and throwing the kitchen sink at all the hallmarks of aging. Many doctors do not know that, and it will also take individual. Every person will be responsible to be educated about what they put in their bodies, and will also take the government to take care of us as regard, banning certain the artificial stuff, the dyes that they put in our food, regenerative agriculture. It's not just enough to eat organic food and avoiding the pesticides, but also to get the whole spectrum of nutrition that the people in the blue zones eat.
Yeah, see, I think one of the I don't know. Do you think that one of the problems with people eating healthier is the cost? Because it's very cheap to go and inconvenient to go to fast food, which really isn't good for you. But it's a lot harder to eat healthy. Is that a barrier for a lot of people?
I think so. I think it's a big barrier, but I talk in my book that the biggest barrier we have is really not the hallmarks of aging. It's a barrier that we put in front of ourselves. We'll say, I'm too tired to work out. It's too cold today. I don't have the money to work out. People have to, health should be their number one priority. They can cut on their expenses, whatever they do. I see people paying $800 to go see Taylor Swift.
Right, exactly.
They don't want to pay for a supplement. So people have to set their priorities straight.
That's
Health
funny.
is the most important thing that you have to deal with.
That's funny. Well, the title of the book is called The Ageless Revolution. Where can people catch up with you online, Dr. Aziz?
They can go to my website, www.theagelessrevolution.com, or my office website, michaelazizmd.com.